Hey, greetings, friends. Dr. G here, the home office, and I wanted to update a few things. So I have been continuing to follow the current state of affairs we live in now and how it pertains to our health. And I have a few announcements about my practice and also some testing, as well as some special supplement kits that I have put together and to go through some of where we are. Here we are, April 14th, 2020. And as we've seen things just keep on changing in our world, in our countries, and in our state, it's never ending. So I want this to be as productive and as helpful as possible. So I don't want to delve too much into the negativity, but I want to cover a few things that I think, just as a responsible thinking human being, I want to get across. I present this again as not medical advice for any individual, but I certainly invite you to consult with me directly. I'll link how to do that below. And to that point, let me get right to it. So in regards to my practice, it was a good news to see that the serum antibody test for COVID-19 has been developed, and it's released and now available to providers. And I have some test kits on the way myself. And I'm looking forward to being able to offer that to my patients and those who'd like to have that checked. Now, let me just cover why you might want to do that. So this is the test that identifies if you are now carrying immunity to this viral infection. It's not used when you're actively sick, because there's a transition period where your body has not made any of the immune markers for this infection. So initially you develop, this immune response that it's sort of non-specific, and it can take weeks typically for you to develop more of the specific immunity that's making these antibodies essentially that protect you in the future from a reinfection of this virus. So think of it as a natural vaccine in a sense. It's really a, it's excuse me, an immunization for you to be exposed. This is the great dilemma that we live under. I could really go on about this whole fear factor that's been going on, and really it's been a campaign of misinformation. I've spent the last 20 years looking at health and human health in general, but specifically how we work in harmony with not only what we know from science, but with how our bodies are actually designed as an organism. And our mainstream medical model has many flaws. It has some great successes, and we certainly want to recognize that, and we need modern medicine. However, those that have been advising our policies within our states and even on a national level, and many of you who might be watching this know what I'm talking about. If you look at some of the downfalls of our medical system, from the costs, the lack of solutions for most of our common concerns. And for viral infections, it's really no different in that it is one sort of one size fits all mass approach to everyone in these heroic interventions, and at the same time ignoring all the things that we each have control over. There have been so many doctors, thankfully, coming out who in clinical practice who are seeing these COVID cases on the front lines, who are coming out and talking about some of these problems they're coming out. And I just saw another one today, and this guy is actually MIT doctorate level. He's actually running for the Senate, I believe, in Massachusetts, but Dr. Shiva Ayyadurai, and I'll put his interview he did, I'll link it below. He kind of covers the gamut of what's going on and what's missing in our national approach right now. And so this is starting to, everybody's huddling in their homes, everybody's living in fear. And as I started to talk about weeks and weeks ago about what we can do to help ourselves to break free of fear, and to not worry and the harm that it does to our immune system. And now we're finding out that this has been, I think, unfortunately, a misguided approach. So I'm not saying that these strategies aren't helpful in some cases. But I am absolutely confident that we're now going to see the downside, the side effects of having this mass quarantining, the stay at home, stay safe, stay at home. I'm sorry, that this is such a simplistic and, in my opinion, an idiotic view, okay? We could all stay safe and stay at home, okay? Never get in our car, never get on a plane, never be exposed to any infectious disease. The reality is that's not going to happen, of course. And our well-being and health depends on straining and stressing of the organism. So if you simply just sit around the house and eat, of course, junk food and watch TV, we know what will happen. Our immune system, our sense of well-being, our mental emotional state, it's a very complex topic, and depending on individual circumstances in homes where there's a lot of stress and strain, there's a lot of mental disorders, there's addictions, there's kids in crisis and domestic abuse. Again, these are all very complex issues in our society, but to think that it's going to be healthier for us to all huddle home for months and months is being disproved daily, as we see. And of course, the numbers are starting to come out, and there's a lot of misinformation. It's very, very concerning to me. So I will try not to go too much into the political side, but I'm thinking about this from a very analytical, having spent the last 6 weeks researching, listening to a lot of people who are much smarter than I am, and not the constant stream of the media and what you're getting from press conferences, etc. Let me get back to, I'm going to jump over to screen share because I think I stay on task, and I don't want to go really long, but I've got a outline here. So April 14th, health update. So as I mentioned, those serum antibody tests are now available. I should have them within the next couple of weeks. Contact me if you'd like to get on the list. I'm only going to be getting in so many kits until I see what the demand is looking like. So now, to that point, the other thing I wanted to announce is that I am going to start in-office appointments again on May 4th, Monday, May 4th. So that means for appointments, that means for blood draws, that means supplement sales and pickup. I have been spending these weeks also stocking up and continuing to order directly from the manufacturer contacts that I have with some of the best nutritional supplements. Today I was just on looking at some of the online sources, and there you can't find zinc, vitamin C, and vitamin A, especially now that they came out and we're talking about the zinc and the hydroxychloroquine. You can't find zinc anywhere. So I have some, and I will continue to hopefully be able to find it through my sources. So, so in that point also, I will be restarting to do in-office blood draws. So just so you know, for my patients and those that will be needing just basic blood work for a number of things, including hormone testing, metabolic problems, and also for this COVID-19 test. By the way, those results they're saying in just a couple of days. So, and this is, like I already said, is an indicator of natural immunity. There's a lot of evidence that this virus was actually present on the American continent much earlier than we once thought. And so there is probably a lot more people who've been exposed and are carrying the antibodies to this virus. Now, I've been predicting this for a while, but I just want to state something. And the point of this is to say I'm trying to alleviate fears around these infections. This is not a death threat. This is not like, we're under World War II attack, from a foreign entity. And the way this gets reported is that we're all at risk is absolutely a myth. That does not mean that we don't take actions to minimize the spread of infectious diseases to those that are most vulnerable. And right now we have to follow the laws of the land, but I would invite you and just ask and plead that you contact your governor, contact your local legislators, and let them know that you want answers. You want to know what criteria. They're saying that a lot of this is science-based, but a problem is they've got one ear open to one point of view, and they're ignoring a lot of evidence. and I'm just getting to the point where I see the health consequences that are now they're going to far exceed whatever this virus could do or would have done. So point is that a lot of us are walking around with natural immunity to this virus already. And we should be aware of that so we're not afraid all the time just to go out of our house and do our basic activities. So yeah, in testing, it might really enhance our sense of well-being. So I'd highly recommend it. I plan on doing that for myself and family and those that I work with. So as I mentioned, May 4th, I'll be opening. I also, by the way, offer these monthly care plans for those that don't able to pay out of pocket. This enables you to spread that out. I also am able to accept HSA, FSA account funds. And so just a side note on that. So by the way, what do I specialize in? So general medicine, infectious care too. This is something I've been doing for my patients, is to provide an option to avoid going to urgent care or medical emergency rooms where you've got something that's not an immediate life-threatening condition, but say a cold, flu, etc., that can be managed either remotely through the phone and telemedicine, or if you need to get tested in office. But there are many things we can do. I'm going to talk about antibiotics if I have time here, by the way, coming up. So let's see. So supplements, let me flash over to these. I want to talk about this Wellness Immune Kit. I've got 3 things I want to talk about with supplements. And I think I can screen share. Let's see here. How do we do this? Stop, please share this window. New share. Here we go. Learning how to do this. So hopefully you can see this. This is the Purium Health line. Now I was able to order these, thankfully, because they have one of my favorite companies for a long time, and I mentioned them in a previous video. But I have gotten these home as a kit for myself that I'm doing every day. Includes this pot of cherry. This is tart cherry extract, more greens, which is a combination of the best nutrient-dense green foods and a few other things in a powder, a white American ginseng, and then the virus sure. So it's kind of an all-around wellness and immune support package I'm going to be putting. I have this together. I ordered some for those who would like to have this as well. I won't go into all the benefits, but I'll kind of say, I guess, a couple of things about each of them. One of them is this tart cherry, is that it is one of the most antioxidant extracts that you can get, very low in glycemic effects in terms of sugar. It tastes good. It's cherry-like flavor, but it does not cause blood sugar spikes. It's been studied a lot in athletes, and also for a number of inflammatory conditions. And so, things like berry extracts, those dark pigmented foods, largely from both vegetables and the fruit kingdom, but citrus extracts, etc. But in cherry, there's a lot of studies that have showed improved anti-inflammatory effects, things like prostate health, anti-cancer effects, and the anti-inflammatory effects. As we know from the ARDS, this is the syndrome where a chronic pneumonia-like or lung infection can trigger this cascade. And what we need to do is kind of break that inflammatory cycle. So very applicable, though, for daily use. And then more greens, of course, it's that, I could tell you stories about reversing cancer, about reversing autoimmune diseases, when we can shift from a very processed foods, high sugar, high carbohydrate diet to a very nutrient-dense, phytonutrient-dense diet that includes these leafy greens. And if you're like me, as much as I can buy and try to eat my salads and kale and all that, sometimes I just want that extra insurance when I can't do that. And so I include this in the shake, in this powder. It actually tastes pretty good as well. White American ginseng, I talked about ginseng in another video as well. And it is a very, it's just got to be one of my favorite adaptogens. So an adaptogen is a herb that helps our bodies cope with stress. There are improved effects on the immune system and the adrenal axis that manages stress in the body. So it can actually have an energy lifting effect with an emotional sort of a calming effect at the same time, and sustaining better immune function. This is a glycerin extract. So it's helps, by the way, with blood sugar stability, and it actually tastes pretty good because of that glycerin extract. It's safe for kids, anyone, in most cases. So, and then finally, VirusSure, for obvious reasons. So VirusSure has a combination of extracts that help to inhibit viral replication. Now, of course, we know some other things that, you know, we've talked about zinc and the vitamin A and vitamin D. There is a cluster of basic nutrients that I would highly recommend. And so I'm continuing to stock those. So these are kind of a more food-based, you know, higher level of support that I think through this stressful season, any flu season especially, but if you're in a season where you just can't eat as well, you might consider these. Then let's see, I've got, yeah, again, more inventory in stock every day, getting more and more in. Let's see, did I get I don't think I got a picture of it, but this keto kit I put together, and I did another video with Zalo and down there. I did this video on with Dawn. I was blanking on her name, my colleague, good friend Dawn. We have been putting together some keto support programs, and I have a keto kit. This is essentially the basics to get into ketosis and get those benefits without necessarily launching into the diet. So I put those together, exogenous ketones and MCT and MCT powder. And then lastly, probiotics. So I put this photo because I have a new supply of Claire Labs probiotics that I can't begin to tout the benefits of probiotics. Now, the microbiome, this is the makeup of the microbes in your digestive tract and on your body, are absolutely essential for sustaining your immune system, which leads me to talk about antibiotics. Antibiotic use and the overuse of antibiotics has caused, I think, one of the biggest impacts, negative impacts on health. When you take antibiotics for a period of time, you wipe out the healthy flora, this microbiome that is essential to provide your defense. You know, many people develop things like an autoimmune disease or an allergy or an other inflammatory disease from courses of antibiotics. And sometimes it takes more interventions than just getting on a probiotic, but between feeding yourself and your gut the right foods, these healthy, more fiber-rich foods, and getting these probiotics, what we've got now is science has been able to develop probiotics based on individual need. So age, male, female, even older adults versus younger adults. And then so there's some basics. So there's strains that you take and have a difference in terms of their effects. So they've got detoxification support, women's formula, children's chewable, absolutely love that one. And then the senior formula and this Pro 5 just came out, which provide more support for those categories of folks. So highly recommend that you, maybe even a few times a year, you go on a probiotic. Anytime you've been sick, get on a probiotic. Anytime you do get on an antibiotic, absolutely should take a probiotic. Fermented foods, you know, if you're not eating sauerkraut and you're not into, of course, commercially made yogurts are in many cases they're more garbage foods than actual probiotics. You should consider supplementing with one. So those are the couple of things that I had pieced together to emphasize in this video. Let me go back to my new share outline. So I think I kind of covered a lot, but I want to, I guess, talk and wrap up here. The consequences of stay at home and the myth of stay safe, stay home. I realize that this is going to be a deviation from this line, this tagline in public health that's being, you see it in infomercials and those public service announcements, and everybody's saying it. Now, I am saying if you're sick, if you've been exposed, and if you have contact with vulnerable people in the current state of things, we need to follow those guidelines. But I want people to stop living in fear that they are going to be a victim. Staying safe does not mean staying at home and not doing anything, okay? You need to be getting some fresh air. You need to get some sunshine. You need to plan for the future. And if we can't get our state governments to give us a timeline, we need to be putting pressure on them to begin. You know, I'm in the state of Washington, And on the West Coast, and we're seeing on the East Coast, there are some states that are starting to give more guidelines and come out with something. They have got to take a common sense approach that's going to provide a healthy environment for all citizens and not live in this quarantine state for the foreseeable future. So this is having a real impact on mental and emotional health, okay? Now, mental emotional health equals physical health, okay? They're intertwined. There's no separating the two. If you do not have, that's why physical exercise is one of the best ways to break some of the mental and emotional conditions that we struggle with, depression, anxiety. So, you can work out inside, I realize that, but you do need to get out. Of course, the vitamin D from the sunshine, we don't quite get enough sunshine quite yet, but we're getting there. Usually by this time in even the Pacific Northwest, you can get out and get vitamin D from the sun, but that fresh air and that sense of purpose, when we don't have a timeline for when this is ending, it's easy to get down and to not, it's like, I get it. Everybody had to kind of do a reset, and we need to be able to have a planned return to some sense of normalcy with a new sense of awareness. We should all be going forward with a new understanding of infectious diseases and how we all need to be prepared and be respectful to others around us. If you're sick, stay at home. If you're coughing, cover it. And I realized that, it's funny because we're in allergy season right here, right now, at least for me. I know a lot of people have tree allergies. We're seeing this, and we're in fear of just being out and sneezing, coughing because we have allergies and because of the way people are going to fear and look at us. And, and of course, right now we're minimizing going out. By the way, I know some great natural remedies, thankfully, to control those allergy symptoms, but that also reminds me, I wanted to, besides antibiotics, there's a couple of other medications I want to cover and the harm that they do and potential downside of taking those if you do happen to be exposed to COVID or get a viral infection. So I have seen so many very concerning developments across this country, and the loss of freedom and the police state actions that are going on, people being fined and arrested for not causing any harm to anyone around them, but from a very heavy-handed enforcement of some very illogical laws, at least in how it's being interpreted and disseminated. And so, a father being arrested at a basketball court, I think it was in a park, or no, excuse me, it was T-ball. I think that was in Colorado. You had a surfer, or a few surfers completely away from anyone else, arrested and fined for surfing in Malibu. And I've heard some more promising things from some of the states about easing up and actually, helping people being able to get more outdoor exposure while still being protecting them. So, by the way, I mentioned that doctor that has a YouTube video from Massachusetts. I'm going to link that below, but he really outlines a lot of the problems that's going on. Now, if any of you have been watching these press conferences, you know that they've been downgrading. I mean, these death estimates, it's laughable what they've been saying, and then they're changing over time, right? So now what was millions of deaths, hundreds of thousands of deaths, down to 50,000 deaths. And now we're starting to see, I mean, when we realize how many people are dying from other causes of death, this becomes laughable. And it is absolutely a lie for people to say that the quarantining measures are largely to contribute to that. Again, yes, it's reduced, I'm sure, some of the cases. I'm not talking about it not helping, but they are cooking the books. This is not me saying this. This is the reporting recommendations that are happening in a lot of circles, is that, and I want to talk about this one computation. When we talk about the death rate from COVID-19, you have to realize that this is a very difficult number to get accurately, okay? You need the total number of actual deaths from COVID-19, and I say actual because if you were to be aware of what's going on in these hospitals and the causes of death tabulation, they are actually recommending that it's presumptively given a COVID-19 diagnosis of death, a cause of death, even when not verified, okay? In addition, the bottom number of this division problem is that the total actual cases, we can't even begin to know what that is accurately until we have a good sense of all those that have been exposed, and that new serum test will help with that. It is clear that we are falling below 1%, if not even higher, if we take what the estimates are likely to look like once we get those numbers. And so these fatality rates that were initially used as fear tactics, they were greatly overstated. I mean, again, these models were way off. And there were a lot of very smart institutions and advisors who were much more in the ballpark, who were being ignored by our public officials, and that still our government seems to be ignoring them. But I hope that public awareness on this can begin to put pressure to start taking a more targeted approach. And again, I'll just comment, obviously my expertise has been in 20 years in the alternative community. Now that doesn't mean I throw science out. I was trained in a way that takes all the scientific research and also the traditions of medicine that we've learned over the eons of time of humans being on this planet. And we couple that together to try to take a common sense approach. You know, it's not one size fits all. We need to treat individuals as individuals. And the complexity of human health is beyond any other machine model that you could possibly think of. We have so much power in our hands and with our families in terms of boosting our basic health. I've already talked about those lifestyle factors that we know increase your risk for not just COVID-19, but it'll be the next viral infection or death from a pneumonia. We know it's metabolic syndrome. We know it's obesity. It is the pre-diabetes and the weight problem that we have in this country to a large degree. And that's just a simple, more observable sign of the problem. And that is that we've got an overabundance of simple carbohydrates going in, and an underabundance of people consuming those healing foods that we need. And so that's one of the reasons I really recommend breaking those addictive things that we all have towards foods with ketones, etc., as well as hormone assessments and looking for metabolic problems that we need help to correct. So I think I'm going to end this video, and I am going to, how do I stop sharing? I'm going to end this video. So appreciate all of you watching this, but, you know, stay informed, stay, you know, in touch with what's going on. Don't just believe the media. In fact, don't listen to the media too much. I'm going to try to link some of my sources, but, you know, again, we all need to think about this and not be told what to do. So there I am, I'm back. So thanks for watching. See you in the next video. Contact me if you'd like more information on getting care set up with me, and I'll see you in the next video.